It's a pleasure to be with you. The title of this session is Organization and Financing of Public Health, Part 7, CDC, National Center for Health Statistics, and other centers. There are no disclosures for this presentation. Objectives include review the major functions of the National Center for Health Statistics, discuss two practical examples of the use of statistics in public health, briefly review 10 major surveys and data collection systems used by the National Center for Health Statistics, review the Center of Surveillance, Epidemiology, and Laboratory Services, the Office of Readiness and Response, the Center for State, Tribal, Local, and Territorial Support, the Center for Global Health, and the Office of Minority Health and Health Equity. The last three sessions discuss the CDC's National Center on Birth Defects and Developmental Disabilities, the National Center for Chronic Disease Prevention and Health Promotion, the National Center for Environmental Health, and the Agency for Toxic Substances and Disease Registry, and the National Center for Injury Prevention and Control, and the National Institute for Occupational Safety and Health, NIOSH. We'll now briefly discuss a few additional CDC programs, offices, and centers that support national public health efforts. Let's start with the National Center for Health Statistics. Sources of data used by the CDC include vital statistics records, medical records, personal interviews, telephone and mail surveys, physical examinations, and laboratory testing. Public health surveillance data is used to characterize the magnitude and distribution of illness and injury, to track health trends, and to develop standard curves, such as growth charts. The discipline of statistics involves collecting data, organizing it, analyzing it, and presenting it in a way that makes it easy to understand. Public health statistics provide insights into the underlying patterns and relationships of data, which can then be used to design research, develop surveys, design models, predict future events, and develop public health strategies at the national, state, and local levels. The CDC employs hundreds of mathematical and health statisticians to do this work. Let's consider two examples of the practical use of public health statistics. Mintz and colleagues used data gathered from a salmonella outbreak to study the relationship between the number of Salmonella enteritidis organisms in hollandaise sauce, the infectious dose of organisms, made from grade A shell eggs, and the time people who ingested that sauce developed gastrointestinal symptoms, the incubation period of the disease, the severity of symptoms, and the duration of their illness. They found that the incubation period in hours decreased in the high versus low organism exposure groups, 17.5 hours versus 37 hours. They also found that high versus low organism doses were associated with more body aches, 94% versus 71%, vomiting, 57% versus 21%, increased weight loss in kilograms, 5 versus 3.2, maximum daily number of stools, 20 versus 12.5, and the number of days of bed confinement, 6.5 versus 3. They concluded that the ingested dose of salmonella organisms was an important determinant of the incubation period, symptom severity, and duration of acute salmonellosis. Anist and colleagues analyzed the second National Health and Nutrition Examination Survey, NHANES data, that included blood lead levels in the United States and demonstrated that lead levels dropped approximately 37% from February 1976 through February 1980. The trend was present even after adjusting for differences in race, sex, age, region of the country, season, income, and degree of urbanization. Changes in exposure to lead in paint or in the diet were unlikely explanations of the trend. The correlation of blood lead levels with the lead level in gasoline was highly significant, P less than 0.001. Their conclusion was that the most likely explanation for the fall in blood lead levels from 1976 to 1980 was due to a reduction in the lead content of gasoline. In 2022, the NCHS major ongoing surveys and data collection systems are listed on this slide. NCHS data is used for the documentation of population and subpopulation health status, identification of health and healthcare disparities by race or ethnicity, socioeconomic status, region, and other population characteristics, description of healthcare system experiences, monitoring health status and healthcare delivery trends, identification of health problems, support of biomedical and health services research, provision of information for policy development and policy and program evaluation. The National Health and Nutrition Examination Survey, NHANES. The survey consists of interviews conducted in participants' homes and standardized physical examinations, including a blood draw, conducted in mobile examination centers. National Healthcare Surveys, NHCS. The NHCS surveys are designed to provide information about the organizations and providers that deliver healthcare, the services rendered, and the patients served across diverse settings. National Ambulatory Medical Care Survey, NAMCS. The survey gathers data about the provision and utilizations of ambulatory medical care services in the United States. This is a national survey conducted since 1973 and focuses on visits made to non-federally employed, office-based physicians who are primarily engaged in direct patient care. National Hospital Ambulatory Medical Care Survey, NHAMCS. These surveys are conducted annually since 1992 to collect data on the utilization and provision of ambulatory care services in non-institutional general and short-stay hospital emergency rooms, outpatient clinics, and outpatient surgery departments. The survey is designed to provide information on the characteristics of patients who visit hospital emergency and outpatient departments, the services provided, and outcomes. The survey is also used to monitor trends in ambulatory care use, identifying emerging health problems, and develop health policies. National Hospital Care Survey. This survey is designed to provide healthcare statistics that answer key questions of interest to healthcare and public health professionals, researchers, and healthcare policymakers, and includes tracking trends affecting hospitals and healthcare organizations and factors that influence the use of healthcare resources, the quality of healthcare, and disparities in healthcare services provided to population subgroups in the United States. National Post-Acute and Long-Term Care Study, NPALS. This study was launched in 2012. NPALS uses survey data on the residential care communities, adult day services, administrative data on the home health, nursing homes, hospice, inpatient rehabilitation, and long-term care hospital departments. The vision for NPALS is to offer reliable, accurate, relevant, and timely national and state statistical information to support and inform post-acute and long-term care services policy, research, and practice. National Health Interview Survey, NHIS. This survey is conducted annually and provides nationally representative estimates on a wide range of health status and utilization measures among the non-military, non-institutionalized population of the United States. Each annual data set can be used to examine the disease burden and access to care that individuals and families are currently experiencing in the United States. National Immunization Surveys, NIS. These are phone surveys used to monitor vaccination coverage among children 19 to 35 months and teens 13 to 17 years, flu vaccinations for children 6 months to 17 years, and COVID-19 vaccination for children and teens in eligible age groups and for adults 18 years and older. National Survey of Family Growth, NSFG. This survey gathers information on pregnancy and births, marriage and cohabitation, infertility, use of contraception, family life, and general and reproductive health. The survey results are used to plan health services and health education programs and to do statistical studies of families, fertility, and health. National Vital Statistics System, NVSS. This system collects data on births, deaths, fetal deaths, linked birth infant deaths, life expectancy, and marriages and divorces. Data from the NCHS surveys and systems we discussed are available to the public through the NCHS website listed here as public use files. The NCHS also produces standardized summary reports that can be accessed at the website listed. The NCHS data are essential for developing, implementing, and evaluating public health policy in the United States. Other CDC offices and centers include the Center of Surveillance, Epidemiology, and Laboratory Services, the Office of Readiness and Response, the Center for State, Tribal, Local, and Territorial Support, the Center for Global Health, and the Office of Minority Health and Health Equity. The Center of Surveillance, Epidemiology, and Laboratory Services, CSELS, focuses on improving public health surveillance, laboratory systems, and data quality, while also ensuring the development of a sustainable, highly trained public health workforce. CSELS tracks U.S. health parameters and identifies urgent health threats in the U.S. and globally. The Office of Readiness and Response, ORR, works with other federal partners and state, local, tribal, and territorial health departments to monitor for health risks. When a health emergency is identified, ORR provides experts and resources to address the issue. ORR provides funding for health departments and supports readiness and response research. The CDC's Center for State, Tribal, Local, and Territorial Support, CSTILTS, aims to improve the capacity and performance of the public health system at all levels: state, tribal, local, and territorial public health departments. CSTILTS provides technical assistance and direct funding to support the delivery of public health services and programs in accordance with CDC guidelines and standards, focusing on areas of health promotion, disease prevention, public health policy, technology, communications infrastructure, and workforce development. The Center for Global Health works with international partners, including ministries of health and the World Health Organization, WHO, to prevent and control infectious agents like AIDS, polio, measles, influenza, malaria, etc., and chronic diseases, and identification and containment of bioterrorism threats. The center also supports the building of a sustainable global public health capacity through the development of epidemiological and laboratory resources and international public health workforce. CDC staff work in more than 60 countries to support the global health mission. The Office of Health Equity exists to ensure that health equity is addressed in all public health programs. Core goals of the center include: 1. Integrate health equity principles in all CDC public health programs, policies, data systems, and funding structures. 2. Mobilize partners to develop and implement strategies that address health disparities. 3. Develop tools and processes that ensure diversity and health equity, transforming the public health infrastructure. 4. Develop and implement strategies and policies to address gender discrimination, racism, and promote worksite health equity. In summary, the National Center for Health Statistics, NCHS, collects data from vital statistics, records, medical records, personal interviews, telephone and mail surveys, physical examinations, and laboratory testing. The discipline of statistics involves collecting data, organizing it, analyzing it, and presenting it in a way that makes it easy to understand. The NHANES survey consists of interviews conducted in participants' homes and standardized physical examinations, including a blood draw conducted in mobile examination centers. Data from the NCHS surveys and systems are available to the public through the NCHS website. The Center of Surveillance, Epidemiology, and Laboratory Services, CCELS, tracks U.S. health parameters and identifies urgent health threats in the U.S. and globally. The Office of Readiness and Response, ORR, provides experts and resources when health risks are identified. The Center for Global Health supports the building of a sustainable global public health capacity. The Office of Health Equity ensures that health equity is addressed in all public health programs.